Hello, my name is Mariana Cordero Diaz. I will present our work, Residence Wellbeing Program, Self-Care and Wellbeing as a Professional Competence in the COVID-19 Pandemic, from the Tecnologico de Monterrey in Mexico. To make possible a change of paradigm from burnout to well-being, strategies to reduce the stigma and promote a culture of well-being are needed. To promote the most needed curricular reform that includes self-care and well-being as a professional competence, not only for medical residents, but for all health professionals. International studies have reported that quality in patient care and safety, as well as the personal well-being of resident doctors, may suffer a detriment if a highly demanding or hostile clinical learning environment is present. In parallel, academic health institutions identify the need as a central element to well-being to have a mentoring program that supports the resident during their training. The importance of establishing mental health strategies and preventing burnout in residents is a shared responsibility between educational institutions and hospitals. In later years, the relevance of self-care and well-being as a professional competence has been underscored. In this report by the National Academy of Medicine in the United States, it is analyzed and proposed a systems model of clinical burnout and professional well-being, considering not only the environmental factors, but also the individual mediating factors in order to achieve professional well-being and avoid burnout. For our study, the participants in this study include 6 training centers, which represent 290 physicians in 17 medical specialties programs. The Professionalism and Wellbeing Program for medical residents implemented strategies since 2019 for the development of well-being as professional competence. A hybrid model was implemented due to the COVID-19 pandemic from April 2020 to date. The Wellbeing Program for medical residents is the first of its kind in Mexico, and its purpose is to improve the well-being of residents, educating them about the importance of self-care. We designed a program based on some other models like this one from the Vanderbilt Medical School from the United States, where you have to consider different elements of the well-being and also articulating them with your own school or university resources. So we have here in the center of our program the mentee or resident needs, because we are articulating with the mentoring program, and we are looking forward to contribute to his or her development in the academic, professional, and personal areas. Also, we need a curricular design and strategies that supports this, and we have included those in our required course of clinical ethics that all residents have to take in the first semester, and also in other academic protected times during the residency years. It's very important to articulate your support services, mainly the counseling or mental health services. And finally, we articulated some group and peer strategies, as the one that we're showing here, battling groups. And also, this was in face-to-face modality before the 2020 pandemic, and therefore from last year on we have to modify this to a virtual environment too. I will share that later. So in February 2019 and 2020, medical residents were required to participate in the orientation session of the Professionalism and Wellbeing Program, and at least during the semester in 3 sessions. In 2019, there were face-to-face, and in 2020, we migrated to virtual sessions. Also, a leadership workshop for chief residents was designed and offered face-to-face in 2019 and February 2020. Among the virtual strategies designed amid the pandemic to be offered to all medical residents were an online website for the Wellbeing Program, an electronic form for residents' well-being and mentoring follow-up, and individual virtual counseling with our psychology department, and online battling groups in Zoom. I will describe how we implemented this. First, the Wellbeing Program for first-year medical residents from March 2019 to February 2020. A questionnaire on well-being and basic mental health evaluation was applied electronically with prior consent during the orientation. The resident physicians were asked to schedule an individual meeting with the counseling service to learn about the results. And during the semester, the following sessions were implemented in protected academic periods. So we have well-being and self-care workshops, also very specific to stress management and fatigue, but also to analyze personal strengths and vulnerability factors in the clinical learning environment. Two, we have a mental health and suicide prevention QPR certification, that's gatekeeper. It's called Gatekeeper certification, and it's a strategy that our university has adopted to implement with every member of the community. It's a brief certification of how to approach a person that might be having suicidal thoughts and persuade them and refer them to the mental health and services and counseling services in our university. And finally, the curricular element was in the clinical ethics course. We have, this is a required class for the first year residents, and we included it as part of the course, the different themes related to well-being and self-care, so professional competence, burnout, professional patient care, and patient safety, as well as well-being as a professional and social responsibility. Our second phase of implementation was the sessions of the program face-to-face in a workshop modality that we implemented in February and March 2020. They were held with residents of 7 programs. In session 1, we carry out an individual exercise of a personal well-being index by the Mayo Clinic and a personal project of well-being. In sessions 2 and 3, we carry out a group exercise to analyze the strengths and challenges of the program with action alternatives. And we also have in our leadership workshop for chief residents of physicians, a specific 1-day training for the well-being and mentoring program for all chiefs and co-chiefs of the 17 medical specialty programs. And there were strategies for the accompaniment of the resident colleagues. And then the last phase of implementation that was due to the pandemic, we migrated from face-to-face initially in February 2020 to the virtual modality from March and April 2020 to date. We offered the orientation session with the first-year residents of the 70 programs. It was face-to-face, and we have the introductions to the Wellbeing Program and support services. Then we have to change to the hybrid Wellbeing Program for residents due to the health contingency. An online version of the program was implemented in April 2020 with the aim of having close accompaniment, mentoring, and monitoring of residents. We have an online counseling due to the pandemic. An online format was implemented to request an appointment with the psychologist, and the sessions were carried out by video call. And also we have online valid groups for residents doctor. Initially in July 2020, we have a total of 51 residents in 12 programs participated, and the greatest themes for they were interested in were emotional well-being of health professionals, burnout syndrome, and relationship with the resident colleagues. As part of the online program, we designed an online self-report form of well-being. So these are the data that was reported in those forms. As you see, 220 residents from different programs reported in this format that they have been meeting with their mentor, and those meetings were mainly on virtual platforms as Zoom and other media. Also, very important that they were discussing themes related to the academic, professional, and personal development and well-being, and that only in that time, only 28 of them have being with the psychology, the counseling office. So we have this strategy implemented mainly for the residents and on face-to-face in 2019. Then we migrated in 2020 to an online and virtual format, and we have a good follow up with the residents from all the year long, and we have been facing some challenges, but we think that this is a social responsibility, not only with the residents, but with our duty to contribute to the formation of future healthcare workers and professionals. Thank you very much.